What is gender mainstreaming? Gender mainstreaming is a tool for bringing gender equality into healthcare policy, planning and service delivery. The goal is to improve delivery of services so that healthcare providers can respond better to the health needs of different groups of women and men, including transgender persons.
It is sex and gender that's recognised internationally as social determinants of health. So, I mean, these kind of roles that our society has kind of stuck on us really affects the way that we can access health and how we experience health. What stereotypes and prejudice are within the GP's head as well.
Men and women, including transgender people, essentially have different needs from the health system. We need to structure ourselves to respond to those. Gender kind of cuts across other issues that tend to differentiate us. Issues of social class, social status, education, disability, ethnicity. It's a common thread, and unless we have our services structured in a way to address the different needs that are a matter of reality for men and women, gender issues, then our services aren't going to be doing the best they can do. It's really as simple as that.
Traveller women take a burden of childcare. They won't look after themselves first, they look after their children and their husbands and everybody else before they kind of think of their own health problems or any issues they may have. If they have an appointment to go to and maybe the child is sick or anything like that, they might not have anyone else to take the child, or they might prefer to bring the child themselves anyway. So they'll miss their own appointment. Sometimes when I go into a doctor and they say things that I don't understand, I do be embarrassed to ask them to explain it a bit better, do you know, so kind of simplify the words. It can be a bit embarrassing.
Women are more likely to be poor, to be the main provider of unpaid care work, to earn low wages and to be at risk of domestic or sexual violence. These factors have a negative impact on their mental and physical health. 54% of deaths from heart disease are women, yet rates of hospitalisation from men with heart disease and heart attacks are nearly double that of women. Depression and anxiety are 3 times more prevalent amongst women.
There's a lot here on the men's side, but maybe other people might want to add to it. Don't be vulnerable and soft. Gay men have to out themselves in the health system. The gloves go on and makes gay men very self-conscious. Okay, I'm glad that came up. The man as breadwinner couldn't afford to be sick, fear of what might be.
Certainly some would lack the confidence to actually be able to engage with the doctor, you know. Going to a doctor, I didn't feel that I had the confidence to be able to articulate what my needs actually were, you know, and how actually I wanted to know a bit more about any particular health issue that I was raising, you know. In many ways I didn't engage with doctors. I avoided going to doctors, and when I went to doctors I avoided actually really talking to him about my health issues, and more or less it was more a physical check thing, and then he telling me what I needed to do and so on, you know.
Men's gender roles often mean that they are less likely than women to seek health advice, discuss their health problems, visit a GP or participate in activities that promote their health. Societal and peer pressure mean that men are more likely to engage in risky behaviour. 2/3 of treated alcohol cases are male. Men are 3 times more likely to die by suicide than women, yet more women than men attempt suicide and self-harm.
8 years ago in Ireland, it was a totally different space, and that's where I, for the first time, addressed my gender identity, something that was always there, but I internalised it so much that I suffered chronic stress since I was a young child. My gender identity was always female, but I just appeared as male. You know, the first time I accessed, I suppose, a GP, and unfortunately my GP was not there. There was a locum, and he laughed at me. He laughed at me when I told him my situation. Totally mispronoun, totally misnamed, total lack of respect, total lack of awareness. And that certainly is an issue, not only with GPs but also service providers on a whole.
Some key issues for transgender people include isolation, fear, stigma and family rejection, contributing to depression, anxiety, self-harm, suicide, substance misuse. Absence of a designated gender specialist to coordinate delivery of national transsexual health services. Limited provision of psychological support services for transsexual persons, family members and significant others.
I think it's important for all our services to have a gender lens in it. Again, it's recognising for us as healthcare professionals how to engage with people, what will work for them. Because if we're putting money into a service or a project, we need to know that it's actually going to have the impact that we want.
Gender mainstreaming leads to improved quality of services and better delivery of patient-centred care. It makes gender inequalities visible and ensures that there is commitment to addressing those inequalities.
If they're aware of the fact that a traveller woman can't access public transport because it's too far from her home and she might have to mind her children, then at least then they might be able to sort something out, find somewhere that's closer for her to attend.
Looking at the future for transgender health in Ireland, I think it's the perception, number one, needs to change. So the attitude, the social attitude, the service provider attitude needs to change. So I mean, the importance of information within service providers, within the GPs, is absolutely imperative and can be life-saving to transgender people.
I think there's a lot that health services can do. You know, in understanding male gender conditioning, say for example, we're supposed to be strong, stoic, in control and invulnerable. You know, and if we have that knowledge, you know, that's where men have perceived themselves, well then I think, you know, as a health service we need to counter that.
What can be done? Senior level commitment and leadership to have gender sensitive healthcare services. Improve awareness about gender differences in health among healthcare professionals. Develop priorities for service planning and delivery that address identified gender differences. Monitoring, reviewing and reporting.
Unless we do this, we have no real potential to live up to our commitments around many of the strategies that we already have. Everyone with a leadership position, wherever they are in the health system, in the HSE, the Department of Health, in a hospital group, a community health organisation or any of our divisions or directorates, has to demonstrate their commitment to gender mainstreaming and gender proofing by introducing it as an everyday part of what we do. And as a result of that, we can improve the quality of the experience of all service users and make the health service more relevant, make it more valuable and ensure that it contributes more meaningfully to what society needs.